chance to hear it, so let her tell it. People on the streets say Sabrina speaks. Tune into the show, she will let you know. Tell all your friends and family. Real talk is no joke. You get the news straight up from grassroots and concerns. You hear some people gone. So tell all your friends to tune in to
Good evening, Cayman. I'm Sabrina Turner, and welcome to Sabrina Speaks, your daily dose of clarity, truth, and community insights. Every weekday from 5 to 6:30 p.m., we're tackling the issues that affect you, from national headlines to grassroots concerns. Whether you're in traffic or winding down your day, this is your chance to hear it straight and speak your truth. So buckle up, Cayman. We're not holding back.
This is the show. We gotta let you know. Now we got to go.
And now here's Sabrina.
Yep, there we go. Good evening. Good afternoon, everybody, and welcome back to Sabrina Speaks, Voices of the Islands, Conversations for the World, and the podcast where voices rise, stories unfold, and inspiration takes center stage. Now, this episode's pretty much is, I wouldn't say a total extension onto this morning's show, but I really had to pivot very quickly. And that is why I'm going to go a little bit beyond the clinic. That's why it's pretty much entitled the way it is. And we're going to look at how boards are constructed, and especially the Health Service Board. We're going to put that on the little microscope from the legislative perspective, right? So that we can understand the remits of the board, how the meetings are called, and so forth. And we'll also, explore from the perspective of the Health Service Act, as best as I can, break that down with you with legislation that governs our public health institutions. And we'll examine the board of directors and who they are and what they do and how their powers compare to those of even the Minister of Health. So, but we will not only stop there. Of course, your participation is key. And without you, it is a very lonely space, to be honest. We'll dig into a little bit into the Constitution and how that aligns. Does it guarantee a minimum standard of care here? Does it protect every person, Caymanian or not, from being left behind in a moment of medical need? And we'll also compare our system, maybe a little bit. I know you probably won't like to hear this, but from the United Kingdom. Yeah. Which we know we are far more advanced. And to let you know, because some of the questions are coming up are a little complex. And to be honest with you, what I've received, some calls that I've received after this morning's being on Sandra's show, I would really need an attorney on board. And it was too short a notice to even think. And first of all, number two, whether or not they would even want to be here, so to speak. But nevertheless, we're going to try to break it down. But the the opportunity is there. And if they're tuned in today, they're feel free to call in and join in on the conversation, 936-8255. And we're going to be looking in at that. What do they offer and what we don't? What can be learned from mistakes, and what should we demand, pretty much? Because healthcare here isn't just about medicine, it's about justice, it's about dignity, it's about knowing that when you or your child walks into a clinic, that you'll be treated not just as a patient, but a person with rights. And I got some very interesting information from the perspective of laws. Make it make sense. Do you realize that the HSA is governed pretty much under 18 separate pieces of legislations? 18. I stand to be corrected, but I'll tell you, because I just want to get started. So today I invite you to listen closely. Also call in, make your comments be known here, to think critically and to ask yourself, are we getting the care we deserve or just the care we're allowed? Because I am going to be here with you until 7 for sure. And I'm going to break it down as best as I can. But remember, the content you're about to hear, including any discussions or opinions from myself, guests and or participants, is intended solely for general informational and entertainment purposes. It's not a substitute for professional legal, medical, or financial advice. So I encourage you to consult with a qualified professional for your specific concerns. And Sabrina Speaks disclaims all liability for any decisions or actions taken in reliance on the information presented. Please don't forget to follow, like, share, and subscribe so you don't miss an episode. And thank you for all of those new followers. I'm seeing you, and you're well appreciated. Yes. So 936-8255. Let's see who's here. Ms. Rose, yes, you were first to comment this evening. Hi, Connie Bonnie. How are you? Well, you say all devices charged. Can't miss a minute to this evening. Yes, I sorted out the audio. Thank you for giving me that heads up. Jasara, hi. It's a pleasure to see you also in the evening. Damian Henry, good evening. Ready for another educated series? Yes, I'm hoping that again, we will actually, another takeaway again. So yeah, I think what's happening is because Instagram persons, they depend on me to do this stream. And we have been having some issues with Instagram for some weird reason. And I think that's kind of messing up with some of what we're doing here. So I'm doing everything I can to make sure on all platforms that we're getting people, but not everything actually behaves. And sometimes it pulls on exactly how you're streaming right now. So until you actually flag me, I'm only seeing the main streaming device. All the others are in the background, and I don't have like a outright team to say, hey, I'm not hearing you on this, I'm not hearing you on that. And then to troubleshoot that, sometimes that just distorts exactly the flow. Or if I'm delivering something to you, it just really, there's a lot that goes on behind the scene when you are a one-man show here in making sure that I deliver content with you. But thank you. You guys are my tech team. You make me know when anything is off. And I know it because I see all the message coming through. And it's really, really appreciated. I'm being very honest with you. Thank you so much for always having my back. And Pan Unplug. Amen. In Jesus' name. Shared. Thank you so much. Barbara G, it's good to have you in the house as well. And again, it's Wednesday. It's hump day. We're halfway there. Happy birthday to everyone who's celebrating a birthday today, and to all of those who've celebrated yesterday. I'm hoping that you had a good day. And to all of those who are feeling the loss of a loved one, again, our thoughts and prayers are with you. And through this time, we understand how small our community is, and the pain of a lost loved one. It hurts. It hurts deeply. But yeah. Go on to we're streaming on all cmrtv.com platforms, Instagram, Facebook, and of course, Facebook for me. You can follow me, and follow me on Sabrina Speaks directly. That's Sabrina Turner. You look for me on Facebook, look for Sabrina Turner, and then you'll see community activists, and you can follow me from there so you don't miss an episode. That actual platform works well. And like I said, I'm on YouTube. You look for the @ sign, Sabrina Speaks, the number 12. and you can subscribe to the channel there as well. And I'm always on YouTube as well. Just before coming on, I noticed that, hey, this aligns quite nicely. And I know Denny and all of those are going to be like, oh my God, red flag. And this headline popped out at me because I'm seeing where EU rolls out the biometric border checks this weekend. Yeah, OMG. So pretty much what does that mean? What's happening? Well, really what's happening is that this weekend, October 12th, the EU, the European Union, is launching a new biometric border system called the Entry-Exit System, and that would call an acronym of the EES. And it's for non-EU travelers, non-European Union travelers entering the Schengen area, where includes most EU countries, plus a few others like Norway and Switzerland. So when you ask, well, what the heck does that do? What do you mean? What does that mean with this biometric scanning is that instead of stamping your passport, your travel document, border officials will now actually scan your face and get your fingerprints, which they've been doing that pretty much for a while if you travel to Miami, Tampa, Orlando, as we normally do. And what they will do then after scanning that biometrics, because we were talking about it, I think, yesterday, or one other episode, whenever that was, they log your passport details, your entry and exit dates, and how long you're going to stay then into this big database. And so this will take place at all airports, seaports, train stations, and borders across the Schengen zones. And even to UK travelers will go through this when leaving places like Dover or London or since French borders officials operate there. So that's pretty something. And I know we have persons who are tuning into this podcast from all over the world. So if you think we're limiting ourselves, but don't dilute ourselves either. We have Caymanians that are living all over the place. So the whole idea of this is to speed up border checks in long runs, and also interesting to track overstayers. Mm-hmm. So if someone stays longer than the allowed 90 days in a 180-day period, the system automatically helps them in tracking overstayers. And it also helps them prevent identity fraud. Remember, that came up on one of our episodes. Yeah. So the travel document, the fingerprinting, the facial scanning, and all of this sort of stuff, it's modernizing border security. Now, the question lies, well, who's holding all of that data? What does that mean? Does this all play into this New World Order that we're hearing? Does this all come with the 2030 deadline? That, I tell you, there's another show for that. There's another show for that, because they're labeling this and that as conspiracy theories, and people are using it to say, but what they're saying on the surface, whether or not you believe it or not, it's really to speed up border checks in long runs, to track overstayers, to prevent identity fraud, and to modernize border security. Now, you may ask, what happens to infants? What is children under 12 will only have their photo taken, but no fingerprints at that time will be done. So for first-time travelers, you may face longer lines while registering. Mm-hmm. But after that, future trips will be quicker, and just a facial scan to verify your identity. So it's very interesting where we're going. Now, how does this play into the grander scheme of things? I guess only time will tell, right? Let's see what happens. George, what you saying? My Aunt Stella celebrated her 93rd birthday yesterday. Oh, really? Happy belated birthday. And I too hear my mom for an East End drive, and had dinner with one of her longtime friends. She said she had a great day. Oh, that's so nice, George. That's so nice. Those drives are always so, and it's amazing how these seniors appreciate that. Yes, took them out for a drive. I got it afterwards. Yeah, that's good, George. Good for you. It's amazing how these seniors appreciate interacting and going out, for those events. And yeah, we just need to do so much more. But yeah, happy Tuesday. It's a beautiful day to smile and to be happy. And that's how we should be every day. But before we get into the full episode, I got to do this because it's that important. It is that important. But I promise you, it won't be the very long one. We'll be right back after this message.
Infrastructure is more than roads and buildings.
It's our lifelines connecting East End to West Bay, Cayman to Little Cayman, and the Cayman Islands to the world.
It established the route to get our children to school, keep our hospitals powered, and support our businesses every day.
Through hard work, ingenuity, and perseverance, people make that happen.
From the early pioneers who paved the first paths and laid the first pipes,
to the innovators who modernize water, energy, telecoms, ports, and our airport.
they're the quiet hands that build resilience.
And the vision that keeps Cayman going strong.
Now it's our turn to recognize them. Know someone who built, maintained, or improved the Cayman Islands we love?
Nominate them today at gov.ky/YSCH. Click Nominate today.
Welcome back to another episode of Sabrina Speaks. For those of you just joining us, and yes, that is so important because I know that the time is running down and it's definitely coming fast. So yeah, nominate. But this is another episode of Sabrina Speaks, the show where we ask the questions that matter and shine the light on the systems that shape our lives. And today we're diving into something that affects every single one of us. We're going to look at our healthcare system, but more especially the governance behind that. And the Cayman Islands Health Service in accordance to the Health Service Act. So this is by no means, again, it is all informational. It's to educate you. And whenever I speak from a law, and then we break it down, we dissect it. But you're welcome. Welcome to call in. Welcome to message. I will definitely be looking at all the questions that we receive, comments that are made, because you are important. You are the heart. You're the rock. You're the soul of this platform. Now, I know governance might sound like a dry word, but trust me, this is where the real power lies. Who makes decisions about our hospital? Who ensures accountability? And who holds the purse strings at the end of the day? Yeah, these are some of the key questions. And as I was preparing for today's show, you actually I want to look at breaking it down. And you know that the Health Services Authority, let me pull this up, that is ran by a board of directors. And you may ask, well, what does the board of directors do? They actually, and what does it mean? They oversee the strategic direction of our public health services. They approve certain budgetary spendings and as a statutory authority. And they look at policies and monitor performance as well. And then they feed that information up. Now, they're also meant to act independently, but are they truly autonomous? So when I pulled up the law under the Health Service Act, and you look then at some of what is being stated here as it pertains to even meetings of the boards, which we will get there, and the constitution of the board, I thought it was very important for me to highlight certain things because you listen to certain forums and you hear certain utterances in the public's domain. And when you put it all together and you read the law, like how you would read the newspaper, and you try to process it, you really realize sometimes that some people just talk in known foolishness. I'll let you be the judge of that. But let me just go for the sake of this to put it into perspective. In accordance to the Health Service Act, Authority Law, 2018 revision, the constitution of the Board of Authority, that's your board. The authority shall have a board of directors which shall be responsible for the policy and general administration of affairs and business of the authority. The board shall be responsible for the financial performance of the authority, including for ensuring that the authority, A, delivers the output specified in purchase agreements prepared in accordance to Section 26, and B, achieves the ownership performance specified by the ownership agreement prepared for in accordance to Section 27. 3, the board shall have the power to A, act by a subcommittee, and B, delegate any of its daily administrative duties and powers from time to time to such subcommittees and to any other own number and to the employees and agents of the authority, except where the board sets up subcommittees, which consists of members other than directors and employees of the authority. It may only act or delegate its duties and powers to such subcommittee with the approval of the Cabinet. Subsection 4 of the Health Service Authority Law says, the board shall consist of the chief officer of the Minister of Health or chief officer's nominee, the chief officer of the Ministry of Finance or the chief officer's nominee, the chief executive officer, in this case, the CEO, as we know it as, the medical director of the authority, and 7 other directors appointed by the Cabinet, who shall have demonstrated to the satisfaction of the Cabinet substantial knowledge and experience in one of each of the following areas. Remember this morning I said, looking at the HSA board and a lot of the councils established under the Ministry of Health, it's not just harem scarum because of the very nature of that ministry. The law actually states what you should be putting or what skill sets these persons should bring with them. So let me go. The 7 directors, again, appointed by Cabinet, who shall have demonstrated to the satisfaction of the Cabinet substantial knowledge and experience in one of each of the following areas. 1, finance. 2, human resources. 3, law. 4, information technology, that's the same as IT. 5, healthcare. And 6, other related fields. Now, the other related fields here could be members of your civil society, or in this other case, maybe also a representation from insurance. Okay? Now, a person who's appointed under this section, which is Section 4E, shall hold the office for a term of not more than 3 years and shall be eligible for reappointment. Okay? There shall be a chairman and a deputy chairman of the authority, each of whom shall be appointed by the Cabinet from among directors. The board shall appoint a person not being a member to the secretary of the authority, who shall be present at all meetings and shall take minutes of the business transacted. The board shall be deemed to be properly constituted, notwithstanding where is a vacancy in the office of the chairman, deputy chairman, or any other director. There shall be paid to the appointed directors such remuneration as the Cabinet may determine. In this case, the last remuneration upgrade was done in March of 2021. March of 2021, by way of Cabinet directive, was the last time the remuneration of the HSA board was done. The Cabinet shall terminate the appointment of any director who resigns his office, become of unsound mind or incapable of carrying out his duties, becomes bankrupt or suspends payment to or compounds with his creditors So meaning if they're not a good paymaster, they shouldn't be on this, is convicted in the islands or elsewhere of any offense involving dishonesty and fraud, is guilty of serious misconduct in relation of his duties, is absent without leave of the chairman from 3 consecutive board meetings, or fails to comply with his obligations under Section 10, which is all that I have said here. And then if any director appointed under this section dies, resigns, or otherwise vacates office before the expiry of the term for which the director has been appointed, another person may be appointed by the cabinet for an unexpired period of the term of office of the director who died, resigned, or otherwise vacated office. Now, this is where it got really interesting, and I want you to keep following me here. I really, really want you to keep following me here. Because Section 9 of the Health Services Authority Act 2018 revision, meetings of the board, 9 subsection 1, the chairman of the board shall summon regular meetings of the board as often as may be required, but not less than 10 times. Not less than 10 times in any 1 year. Subsection 2. Meetings of the board shall be held at such places, on such days, and at such times as the chairman shall determine. And due notice of such place, date, and time shall be given to each director in writing at least 7 days before the time at which the meeting is to be held. Subsection 3, the chairman may at any time. Let me repeat this for emphasis. Meetings of the board, subsection 9, subsection 3, 9, section 9, subsection 3. The chairman may at any time call a special meeting of the board within 2 days of receipt of request for that purpose addressed to him in writing and signed by any 3 directors. You hear what I say? The chairman may at any time. A meeting of the board shall be presided over by the chairman, in the absence of the chairman, the deputy chairman, or in the absence of both the chairman and the deputy chairman, such director as the directors present, other than the CEO, the chief executive officer, and the medical director of the authority, elect to act as chair at that meeting. What that means is that no point in time should the CEO and the medical director of the authority ever act as chairman of any meetings. It goes into the quorum of the board shall be 6 directors, including the director presiding at the relevant meeting. I felt it was very important for me to actually highlight this, because at the end of the day, some questions came up. Well, then what a minister was doing about all these meetings that they were having. The mere fact that they're duty bound to carry out all of these duties under the constitution of a board, and they have to meet very frequent. Bearing in mind, if there's a tribunal hearing because somebody's appealed a decision, these board of directors has to be present for tribunal hearings as well, for appeals. This is by no means saying I disagree or I'm shooting down that nobody should question the amount of meetings. Please don't miss what I'm saying here. The great takeaway is the law says the chairman can call a meeting at any time. Not even the chairman. Other directors can also, once they get agreeance of others directors. This is the law. Again, if you have a problem with that, change the substantive law. But how are you going to run the day-to-day affairs as cited in Section 8 with their remit if you don't meet? And it begs then to question, if they have to meet so often, what happening to the management? So I hope you're realizing now that the board is made up of individuals appointed by your cabinet. That includes the chairman and the members in the backgrounds with health, as I stated right there. The law is clear of how that board should be comprised. And then this is done when you meet around the cabinet table in caucus, and you see when persons are being expired, and you actually sit down and you weigh in and you ask your colleagues. Usually the chairman of the board is chosen by the minister, because the minister has to work very closely with that board, and especially the board chair. So based on my experience and what little time I had there, maybe I was too nice, but that was done. And I allowed other members of my cabinet that were in the cabinet and caucus to have persons there as long as they met that criteria. So it's not a one-man show, and that was for fair, balanced representation. Now, what happens when those boards then are somewhat planted by persons who are not necessarily with the minister? I can't really say on the surface. Maybe if it happened, they gotta live with that. But I knew with all good conscience that I chose people, and I had a fair, good relationship. Now, when they did foolishness, I called them out. But I'd never one day interfered with the board, because that is and would be illegal. Good evening, caller. You're live on Sabrina Speaks. What's on your mind?
Good evening, Sabrina. How are you?
Hi, how are you?
Okay.
You hear the excitement in the voice?
Your voice is fine.
I think people would say both. What's
Yeah.
up? Tell me what's going on, my friend.
I wanted to talk about this holds the power in our healthcare system. I called in earlier today, Sandra's show, asking about a minimum standard of care, whether or not they've established a minimum standard of care demand for healthcare. Now, since that call in our conversation, I did a little digging. I wouldn't say I went and I researched, but I did a little digging. Did you know that
Caller?
hello?
Yeah, now you're back. Go ahead.
Did you know that in 2016, the Grand Court interpreted Section 12 of the HSA law as conferring immunity from negligent suits on HSA staff except for bad faith?
That was actually in the public's domain, yes, but I couldn't dissect the whole particulars.
And that whole ruling underscores the policy design on patient protection.
If you're on speaker, take yourself off of speaker because you're coming in and out.
Hello, can you hear me?
Better. Go ahead.
Okay. No, I mean, I think that today's discussion about power in Cayman's healthcare system, it raises a very uncomfortable truth. Patients have no legally defined minimum standard of care. And what that means is that the quality of treatment can depend on whichever doctor or facility you happen to, and you end up with a kind of medical lottery, right? Where different practitioners, they bring different standards. Now, when I called in on Sandra's show this morning, one of the points that she made was that, how do we even define minimum standard of care? But I guess some people would argue that defining a national standard would be a bit complex.
Mm-hmm.
But the UK already has certain guidelines, certain condition-specific guidelines. It's NICE, called the NICE
Yes, yes,
the
yes.
National for something care excellence, something like that, right?
That's the perspective you were coming from.
That's the perspective I'm coming from. And for those don't understand, don't know what those are, right? It's a publicly available document that it outlines what good evidence-based care looks like for
Mm-hmm.
thousands of men. If you got it, they have it,
Mm-hmm.
right?
Mm-hmm.
Guidelines they're easy for patients to read,
Mm-hmm.
and they are separate from the technical manuals that I know doctors use,
Mm-hmm.
right? I was, well, I mean, I was trying to argue the point that Cayman could adopt or even reference these standards in law or regulation and update them periodically as the UK does, right?
Mm-hmm.
That would give both patients and providers a shared benchmark for what competent care should mean.
Mm-hmm.
All right, so for instance, right? I was reading up on one of the guidelines, NICE's guidance on, let's say you have a suspected hip fracture,
Mm-hmm.
right? That would call, according to their guidelines, it would call for an MRI within 24 hours
Mm-hmm.
if X-rays are negative, but a fracture is still suspected.
Mm-hmm.
Right. So basically, what it is there to form a safeguard that prevents misdiagnoses.
Right.
Right. The standards like that aren't about bureaucracy and red tape and that kind of
It's
thing.
just getting access to healthcare.
Right.
But
And
we
they
don't
save
have that.
lives.
We don't have
And they,
standards here. Apparently, the government was trying to create that, but then they were interrupted by COVID. And to be honest with you, at the end of the day, I started to do a national health care plan, and not saying that that would segue into it, but I know a lot of interruptions happen. And I saw where a question this morning came into what happens with everything that was started under my term. Again, it's not about me. It's about continuation as it pertains to the health and wellness of our nation and access to healthcare at the end of the day, right? So what you're speaking about right now, because something was possibly started under me, it could actually just stay there. And it's not like, I think I explained this in the earlier days, not to digress, but to show you where from one administration to the next, there is no continuation, because it may not, in the eyes of the operational arm of government, be right for them to give you a sundry of things that were started or probably didn't finish, to want to find out whether or not is this something this administration would be willing to continue. Not all the time that happens. I was asking for stuff, and it was as though I was asking for you to go into Fort Knox. You see?
Hmm?
So this is where the hindrance comes in, and who suffers at the end of the day are the people. But please continue.
well, another point that Sandra brought up, and I heard when she called you and you spoke on the show this morning, right? You were talking about the JCI accreditation, right?
Yes.
I mean, I stand to be corrected, but just based on my surface level research on it, um, from my view, I think it's important to understand what that actually measures. Based on my research, it seems that JCI isn't it a paid accreditation?
It's something you
That
have to pay for.
So it's a paid accreditation that checks whether a hospital has documented safety and quality systems, right?
Mm-hmm.
But it doesn't independently compare a hospital's clinical practices to these NICE guidelines that I just talked about, or any other external medical guideline. So then, what a point!
Mm-hmm.
What a point!
I
I mean,
get it. I get it.
accreditation is useful, but I mean, it isn't proof that Cayman's hospitals or HSA hospitals follow any international standards of care, especially since those JCI surveys may only cover certain departments,
Mm-hmm.
right?
Mm-hmm.
So for me, I mean, until Cayman defines a baseline standard, whether that's through legislation, regulation, official adoption of the NICE style benchmarks, the accountability that you spoke of. I mean, this is only one part of it, right? But the accountability or lack of accountability that you spoke of, it remains uneven, right?
But to
Doctors
not
and-
mix the two together in what you're talking about, the NICE, the JCI accreditation is, it actually accredits the facility, the hospital. It's actually like pathways are for national standards. So I don't want you to mix the two up together, because the accreditation and all that sort of stuff was actually accredits the hospital, the facility, making sure that they're getting up to standards from a national perspective. We see
but
where
isn't that misleading to the public?
it all depends on the narrative and when this whole thing was actually done. I'm trying to make sure I keep up with you so that we don't cross hairs and misunderstand accreditation, whether or not it's something that is subscribed to or not. Nationally, what that actually highlighted for the purpose of this discussion was that we were falling behind under international standards, just like we are falling behind under the prisons and how our prisoners are even kept. If you look at national standards, we're way behind the 8 ball, and I applaud those people doing there. Not to say it's, apples to orange, but it's a similar concept. And thank God for JCI that we have elevated certain things, because they were trying to get this facility accredited. Because nationally, they were just way behind.
So you're saying that JCI just assesses compliance with its own standards then, right? The focus on system safety and quality processes.
There we
right?
go. Yes, that makes sure that it's aligned. It would serve us to, bottom line, we need national standards. Bottom line, because then that's reciprocal. Nationally, which is where the ministry comes in, you set the national standards, and then it's reciprocated of what is expected. That would be like the 10 commandments, which I started the work, would be the 10 commandments pretty much, are the constitution for healthcare standards, practices, that what they should be abiding by. And then what is expected of everyone in the healthcare industry, and then it's reciprocal. Then you have this oversight body that looks to make sure that you are actually adhering to this document for national standards. The last one was done, expired, I think 12 years ago. And I started it. There was even PR on it that was done, where public was invited, for people in the industry. But there again, what happened? We're seeing where we need it, but then at the end of the day, because, it maybe was started under that minister, we're just going to hold on it. And who suffers? Who's suffering?
The people.
Exactly. And that is where the immaturity comes in, unfortunately, and the people then suffer. I was actually challenged, caller, during the campaign time, that the reason why I did not, is because I was only speaking I, me. Really? Yeah.
Well, I know that, I know that doctors and institutions, they operate under general professional ethics and, the common law negligence test, but there's no proactive condition by condition yardstick for what quote unquote good care should look like. So,
well, this would actually do it. If we had a national standards, right? It would actually protect the patient far more directly, but more from a complex standpoint, and put it into place is because of the nuances involved with in command are pretty much unique in a healthcare environment. And the hospital itself would have been responsible for getting accredited, but the Ministry of Health at that time would be responsible for setting the national standards, because national standards would apply to every single healthcare practitioner in this jurisdiction. So the hospital's mandate would be to get up to speed, get accredited, but then the national responsibility then would fall on the ministry for creating that document. The ministry can't be biased. The ministry, even though the hospital, HSA, is the government's hospital, and I will go into funding and how it's funding and all that sort of stuff. I even have some stats as to what it's costing us and whether or not long-term, it'll just put the proof in the pudding of what I was speaking about this morning. At the end of the day, we have to look directly at the complex nature of healthcare and the management and or mismanagement thereof if we want to really make sure that we're servicing all of our people. But this document that needs to be had, and how the role of the ministry from a national perspective, even though HSA is a government hospital, a ministry can't just look at it so insular. They can't just speak about my HSA. This is why the boards have to comprise of a diverse amount of people, even from other competing healthcare facilities.
Well, to that point now, because I would just get ready to ask you the question. You talked about who according to the law spells out who's qualified to sit on these boards.
Yeah.
Shouldn't at least one seat on these boards be reserved for some sort of patient rights advocate or someone outside that same medical establishment?
Of course, and this is why that part of the board and who it consists of, other relative fields, is there. It's there. It's
What are
there.
your thoughts on board members having fixed term limits or
Um,
performance evaluation?
that can be considered as well. But again, the law in Section 5 clearly states a person appointed under this section should hold a term office for a term not more than 3 years. But, I don't want to rewrite the law here, and shall be eligible for reappointment. So fixed term is one thing. It's already enshrined in law. 3 years, or shall be reappointed. So it's not that it isn't there, caller, it's there. And when you look at the pool of even the persons, when you have something so rigid like this, where it says you need to have finance, human resources, law, information technology, healthcare, and other related fields, when you look at the pool of our people here, it's almost impossible to fill this in accordance to law, because if you do this otherwise, then you would be in contravention of the law. To say, well, oh my God, well then that's conflict of interest. When you look at the amount of, even you're talking about remuneration of people on these boards, at the end of the day, and what these giving back of service is means to your country, these doctors and professionals are leaving their, in many cases, private practice to give of service. When you look at even finance with the allegations around how they're having meetings and it's under the Whistleblower Act, that it's outright looking as fraud in the system. These are people who are working in private sectors. Do we know what we could probably be doing for their reputation because of the allegations? You got human resources professionals that their reputation is at stake. You got people from the legal fraternity that their reputation now could come into question. And then when you look at the law, that the law clearly states a chair shall summon regular board meetings.
May.
The chairman of the board shall summon regular board meetings of the board as often as may be required, but not less than 10 times a year. And the chairman may at any time call a special meeting of the board within 2 days of receipt of the request. So this could be for extraordinary circumstances. This could be, like I said, for appeals tribunal. Should something big come up, should there be, their responsibilities allows them that flexibility to have meetings on demand. So the hospital would have been responsible for getting, let's say they're accredited, but the Ministry of Health would be responsible for, like I said, setting national standards because of the national standards that would apply to every healthcare practitioner in the islands.
So from a broader philosophical angle now, right? Do you think power in our healthcare system lies with the medical professionals, the administrators, or the laws that govern them?
I think it's a balancing act. But none of those persons, because I noticed at the latter, you said legislation. If you put it in law, let's make sure we're acting in those capacities in accordance to law. Because then if we act outside law, then it's just words on paper. And that is a similar thing that we're seeing coming from how we even look at our Constitution. So it requires a lot of moral compass for the persons that you place on these boards, councils, and committees. And then if they have the appetite, the will to do exactly what I'm doing right now, pick up the law and read it to know what's within your remit. So that when crap comes down the poop chute, you can say, hold on, but that's outside the law. This is what the law says. Why are you going this way? Knowledge is power. Because right now, this board are the gatekeepers of how the operation of that. And hold on, it gets more interesting for the sake of you being here. It goes on to the Chief Executive Officer, which is Section 14 of the Health Services Authority law. The board shall appoint at such remuneration and on such terms and conditions as the board may think fit a chief executive officer who shall be a full-time officer and employee of the authority, and B, the principal executive officer of the authority entrusted with the day-to-day management and administration to the extent of the authority delegated to him by the board. Now, in this case, him is in broad context, okay? All right? So don't take that literal. 2, under the same subheading of Chief Executive Officer, the Chief Executive Officer shall render his services exclusively to the authority and shall be answerable to the board for his acts and decisions. Should I read that again for emphasis? The CEO shall render his services exclusively to the authority and shall be answerable to the board for his acts and decisions. It ain't one way there. I see where they're answerable to the minister. Subsection 3. In the absence or inability of the chief executive officer to fill his duties, the board may appoint a senior employee of the authority to discharge the duties and functions of the executive officer during the period of his absence or disability. Let that sink in for a little bit. What are you doing, my caller? What are you doing?
I'm taking it all in.
Oh, you better. You're making a lot of noise. But yeah, think about that. Think about that, my friend. This is why I'm empowering you. I am also educating you. That CEO rests and answers to the board, not the minister, not the cabinet. No.
So if the CEO's authority flows entirely upward, right?
Mm-hmm.
Because I'm putting this in context of my thing with patient voice and patient care.
Mm-hmm.
If the CEO's authority flows entirely upward, they're accountable only to the board and not directly to the public. Where does the patient's voice fit into that chain of command?
You gotta hope they give it value.
And if the board can handpick someone to act in the CEO's absence, doesn't that mean power in our health system can quietly change hands without any public oversight?
This is why you choose them wisely. And this is why they need to be a moral compass. And you don't put people on these boards because you're saying, thank you for being on my political campaign. There's more than meets the eye when it comes to putting people on these boards and councils. But it speaks a lot of those who have been given this noble opportunity to serve the country when they go sideways too. That says a lot more about our people than the cabinet who is even supporting them. That says a lot about each individual, caller. Because I could probably nominate you based on your feedback that you're giving me here in this forum, and you're always coming with sound topics. You come well informed. But how do I know that you don't have a hidden agenda or is connected to somebody who has a hidden agenda, maybe with one of the other healthcare facilities or one of the insurance companies? I would only recommend you as a sitting cabinet minister based on who I have gotten to know. And that all depends on how much you reveal to me about yourself. So at the end of the day, the moral compass lies on the shoulders of everyone who's appointed by cabinet to serve our country. This shouldn't be a free for all in a sense where, oh, yeah, I need to be on a board. Be on a board? Yeah. That comes with a lot of responsibility. So it's very interesting.
I mean, if boards can decide what counts as care, I think the cared for should be sitting there too, in my opinion.
Of course. Well, like I said, the composition gives room for other areas to be considered. And you can always call in other people to sit in as well as advisors. That's a power as well that the chairman has at their disposal under this law. You may not be an outright, like a consultant, like an advisor. Yeah. And we must bear it in mind. Being a director of a board don't mean that you're not patient. Every director is also patient. So why would you make decisions? There we go. Every board member at some point will be a patient or have somebody using healthcare services. So if you're given that noble opportunity to serve on a statutory board such as the HSE, you can't be insular. You can't just think of yourself because one day you could become a patient. So why would you not be constitutionally bound based on these laws in what your duties are and functions as a director go contrary because of what? Are you friends with somebody? Really? Come on, man. Be bigger than that.
Well, I'll leave you on this. I don't want to hog the lines, but I think it for me and it all comes back to one thing: standards of care.
Yeah.
And I think without them, every other problem we've talked about, board power, leadership changes, lack of, are just symptoms of a wider problem. If there's no clear benchmark for what safe, proper care looks like, then, just.
Well, obviously, it has been confirmed here that we don't have one. We were on our way to getting that. I started as well, and we saw the need. A national health plan and strategy and all of that was started. Why and will they be continued? I don't know. But we can't look at continuity of certain things that just because they were started under somebody else, knowing that it does have a positive impact on the quality of life, access to healthcare, governance. That could be jurisdictional, reputational damage if we leave it open right now for anything to happen. So at the end of the day, it is a huge responsibility. And like what I'm saying, as we continue to evolve here, we need maturity, not only maturity in how we conduct ourselves in our conversations, how we choose people, because this is not an industry that you want to mess with. Because when this goes bottom up, yeah, we all are going to feel it.
Well, I think real reform starts there. Adopt the international standards like the UK's NICE guidelines, update them locally. I think that gives everybody the same playbook. Make those standards public and enforceable so that patients and doctors both know what's expected. Require the boards and the hospitals to publish how they meet those standards so that accountability is built in and not left to chance. And when the leadership changes or decisions are made, the public should see how they align with those standards, not just who signed off on them. Because at the end of the day, right, new boards, new CEOs, and new accreditation, they don't really mean much if there's no
Exactly.
shared definition of what good care is.
Correct.
And until Cayman defines that, and I'm talking in law, not just in words,
Yeah.
patients will keep depending on luck instead of law. I'll leave you there.
Thank you so much. It's always a pleasure having you joining
Take
us.
care.
Yes, it is a pleasure. Thank you so much for your contribution. And very sound, very sound. But I think one of the things, or some of the things as well, that we need to look at is that when you are a board of director, they're only compensated for meetings. But many a times, there are all sorts of other things that they're also responsible for. They take numerous calls 7 days a week, all hours of the night from the public. They're also tasked with reviewing of documents and minutes. They and meeting even with staff. They're, to be honest with you, overall, I think talking in regards to the national point of things, we cannot say that our system doesn't need to actually bolster up, to mature a bit more, because we continue to evolve. We're seeing where our population is growing. At the end of the day, we are small. Yes, we are. But we also, at the pace in which we're growing, we can't deny that our infrastructure has to be able to keep up. And to say that that particular board, which is who I'm speaking about today, don't have a lot on their plate is an understatement. But the key is to be honest with you, that we have to have a moral compass when we're chosen to serve. And we can't look at certain things from self or whose family is going to benefit, because then you're an outright breach of the law when you do that. And we have to look at sustainability of our healthcare. We have to look into the future. And this is why the STEP survey was so critical. That was so critical in getting that information, collecting all of that information so that it can help us see exactly what the future healthcare needs of our Cayman Islands, all 3 Cayman Islands, will look like, so that we can possibly better forecast the cost and how much persons could actually end up on dialysis, how much persons could possibly end up as amputees or going blind. That is all critical information that will help chart the way forward in even this national document that we can stand by on the principles and standards of healthcare here for the Cayman Islands. So these are not things that you can just do in 6 months, 4 months. This takes your buy-in. This takes your participation. And you heard what the caller said in regards to the importance of patient advocacy and advocates and all of that sort of stuff. They should be all at the table. If they're not already out there and have gone dormant, maybe it's because they have been left out, don't feel that they're around the table when certain decisions are being made. And if that is indeed the case, I am challenging you to raise your hand. I'm challenging you to go to the ministry. I'm challenging you to reach out to me. And let's see how we can get that advocacy group going or revived. Because like we said here, what's the sense of talking about it if you're not going to get results? Hey, Lisa, good to have you with us. Good evening, Sabrina. This is why spiritual discernment is needed. Compassion is critical in healthcare. Yes, you are so right, Lisa. You are so right. But the question then also rises, Lisa, and just look at the price of care. Under the current trajectory and the path that we're going, can the Cayman Islands sustain its healthcare system in its current stance? Let's have the honest talk. Let's be honest. Healthcare in Cayman is expensive. We're seeing that globally. And not just for you and for me, but also for our very own government. Yeah. And in fact, we have seen where recent reports show that healthcare spending has ballooned. to nearly a quarter of the national budget, if not more, and it continues to climb. Now that's hundreds of millions of dollars. And as I said, it's still climbing. So the huge question is, can we afford it? And if not, who pays the price? Put it into context, because we're getting ready now to go down for budget. You're hearing October, I think the 15th is going to be your first sitting of the House, a meeting of the House, and then eventually we will have a budget meeting. Let's start with real numbers. And this is some information that I get, please, for the purpose of this. Between 2018 and 2023, and these are rough numbers, it is noted that we had an estimate healthcare spending increased by 7 to 4%. Now remember, that's 2018, so that covered COVID and everything that happened there, right, to 2023. And we were still, they're residual after coming out of a pandemic. And that reached $246 million. In the first 2 years as the minister, to make sure that all the persons in the hospitality industry were covered by medical insurance, the Ministry of Health and Wellness, then myself, gave up all, you got an output in the ministry called a transfer payment. All of the monies that were in that bucket of money out of 21 buckets that is housed in that ministry couldn't do anything in the constituency, couldn't help students that were coming to me for assistance in going to school to help them, whatever, couldn't touch it. I just couldn't help them because that monies were used to pay for all of those persons' health insurance over that time in the hospitality industry and tourism industry. Yes. For 2 years. You can pretty much round it off. So when you looked at all of that, they were able to access care, knowing that there were no income and understanding the huge impact that the tourism industry was hit with. The Ministry of Health and Wellness paid that. Yeah, paid it so that our people would have been covered during that time. So when you look at what that 7 to 4% that reached $246 million, that includes government funding to the Health Services Authority as well. It includes that insurance premiums for all civil servants, and it's subsidized for vulnerable people. That's a subsidiary for our vulnerable population. That, friends, is reached between that time 246 million Cayman dollars. And here's the kicker. Cayman faces again a 2.4 billion liability for post-retirement health care for civil servants. That's not a typo. That's a ticking time bomb. So when we talk about sustainability, we're not talking about next year's budget. We're talking about the future of the entire healthcare system. Yeah. Another question that we should be asking, to be honest, is where then is the health insurance money going? Remember that the costs drive up the cost of health insurance as well. So that's another thing that we need to consider. And it almost is like a free for all out there, like this real buffet, but someone has to pay the price. This is by no means putting a price on hope of life. This is facts. We have to pay that money. Otherwise, you don't get treatment. But to be honest with you as well, we are wasting money with the management of our healthcare system. That should be a question. Are we wasting money then with our healthcare system? Because if the very HSA is getting away with being so poorly managed, then what the name of Jesus is the rest of healthcare in private sector getting away with? That should be the question. I highlighted it this morning that there is obvious systematic flaws and there is fraudulent, in many cases, claims from the private sector of men having babies. It has been stated here on previous subjects that Cineco is paying for. And Cineco is aware of some of these bad actors. You have other people in the health insurance industry as well that is blowing the whistle, and Cineco keeps paying them. Cayman faces a $2.4 billion liability for post-retirement healthcare for civil servants. That is not a typo. Who is going to pay it? Is it sustainable? We have to talk about our people, because behind every dollar spent is a person in need. For every elderly, for every unemployed individual, and the underinsured or the uninsured, the cracks in the system aren't just financial, people. That is personal. We see our clinics that are unmanned, not functioning as optimal as they should be when public health is funded. And hold on. If you think public health under the Ministry of Health and Wellness is funded, there's a separate line item for district health centers. Different money that is unaudited. So why aren't they properly operational? We're seeing wait times are long. We're hearing it, which is why there's this public outcry for referrals to go to the private sector, despite their knowing that they're frivolous claims coming in. And dignity often is the first thing that is lost, because my own people saying, I don't want to go get health care. I'm afraid to go to the hospital because how they make me feel when I go there because I don't have insurance or I can't pay for a test. This is real. But we are facing a $2.4 billion liability. And that's future funding for the entire health system. And then you think local is one thing? Remember, we got to pay for all those overseas providers too. What are we paying? Tax dollars, even for the overseas providers. And, you know, at HSA, the numbers are astronomical. And because the limited time of delivering this show, and to be honest with you, without the freedom of information and trying to get some information, because they realize I'm educating on them, they don't want to answer my calls. They're not answering my calls. And I'm not asking to call anybody out. I'm just making sure that I'm sharing with you key information. That should be cause for concern. So I guess by right, you go through the freedom of information. Simple little information. Let me tell you something. It's like they fear me because I educating you. The question should also be how much we give at HSE. How much? Bills for more than 24 hours a day. It would be astronomical to know that cost. And here's really where things get uncomfortable when you're talking about mismanagement and fraud, as I alluded to. Hi, Chelsea. Because while we're forecasting, and where forecasting is pretty much unpredictable, because you don't know how much persons, we don't know if there's going to be another pandemic. We don't know if we're going to have a sudden outbreak of whatever, that people may have to be referred to another jurisdiction, that our healthcare system is so pressured that we may have to actually send people off. It's really hard to forecast it, right? And worse, if you got unscrupulous behaviors out there and we see the numbers continuously climbing, then why would you not want to audit these things? I would think that would be the sound thing to do, right? No, child. You just get labeled as a troublemaker. But while forecasting is really unpredictable, mismanagement is just unacceptable, and it shouldn't be anything tolerated. Because we've seen cases, too many of them, where unscrupulous healthcare businesses commit insurance fraud. And like I said, Cineco is being funded and paid for by your money, even though they're a statutory authority. They are aware of some of these bad actors. And there is no requirement for financial reporting in the private sector right now, as it is. We can at least see HSA, but we can't see what's happening in the private sector. But yet certain oh God, I forgot the red flag. Certain flags are being flagged to Cineco about unscrupulous people who are repeat offenders. They know that there is nothing in legislation that these private healthcare facilities has to report. Let me go back. But Cineco is aware of some of the bad players, and they're still paying with your money. They're still paying for men who had cesarean section. That wasn't a slip of the tongue. That wasn't a transvestite either. Because until they had a womb implemented or implanted, that can't happen. But they pay for it. Make it make sense. So the question should ask, why are we, while all of that is happening, the overall bill, we see some of these people double dipping and triple dipping. They exploit the loopholes because our laws don't have teeth. And even when your active ministers see a problem, it takes forever to get anything done because of the layers and layers and layers and layers of bureaucracy. While you, honest Caymanians, are left with the rising costs and the shrinking coverage. Your dignity comes to question, and you start to like, oh my God, you literally begin to have panic attacks. And these unscrupulous actors will come here, they will continue to do it because they know the gatekeepers are asleep. And worse, if you're one without a moral compass and you're always having a blue light special like Kmart, meaning you easily bought. So who do we hold accountable when the system is defrauded? And why are we so quiet when people and money is pouring out with little to no value in return? We'll just avoid HSA. We're not going to go to HSA. Just send me to a private company. Really? And I'm telling you all of them bad, you know. But if they see a loophole, they see an opportunity, some people not got no morals. Some people not got no morals. They could do it. Because if they can get the money and nobody is holding them accountable and they still getting whatever claims they put in paid, they could do it. Who the fool? Who is being laughed at? Our systems. While some of you lose your dignity and come to your MPs with tears. And then they run you through all of this paperwork. You don't have to ask me, I'm telling you. I've been instrumental with helping people navigate the system. And those who have worked with me knows what I'm talking about is true. But let's be real. Cayman will not be able to sustain the cost of healthcare if better management of the public funds is not implemented. And I ain't talking about next week. We're talking, we are in a crisis. But reform doesn't have to mean disruption in your access in healthcare either, which we're seeing that happening. It can mean transparency. It can mean audits, even if they're independent. It can mean consequences to those who exploit the system. But when you got a governing board that has the power in their hands, I could put a full stop right there. And most importantly, it can mean protecting the access for those who need it most. And we're seeing that. Again, it comes down to the dignity of our people and just accessing something that you're entitled to. So even though there's a cost factor here, how do we balance reform with compassion? How do we ensure that no one is left behind while we fix what's broken? Because right now, it saddens me when I see where we're going. It saddens me even more when I know that I was in a position and I saw what little movement I made. I hold on to that. I hold on to that to know my true purpose for being here today. Because it is possible if you get the right people in place. But my purpose is here. Caymanians' healthcare is just not a line item. It's a lifeline. And if we don't protect it, my friends, with integrity and accountability and some sort of vision, we risk losing more than money, you know. We risk losing our lives and trust. Yeah. That's what's at stake. That's really what's at stake. But this is real. This is not a joke. There's no joke in what I'm telling you. Sabrina, we have more actors than Hollywood and still don't have any stars. Darlene, you something else, you know. You are something else. George says, keep your money and give me health. See, there you go. And George also said, you may now know why we love Cuba for healthcare. Well, you can't even go if you want to go to the United States of America. So, oh God, even that is barred from you. Darlene, Sabrina, thank God you didn't go missing. Oh my goodness. Girl, it takes a lot to actually do what I'm doing here. And I have a dear friend who was listening to the interview this morning, who confirms how I've exposed myself and what that means, Darlene. But the mere fact that I made a very profound statement that is by no means a lie speaks a lot more about us than me trying to do my job. Because if you can have a former member of parliament and the Minister of Health have grave concern that should she fall ill, her family has blown the whistle, they're going to think twice for me even accessing health care. Because of not all, oh God, no, not all, but just the overall perception of me fighting for you, the people, in that noble role, and for the hate that is spoken in hollowed halls among certain sectors in the health. Right there, HSA. That's sad. That speaks a lot more about us than me. But if being an advocate, but for speaking the truth, unfortunately, leads to my demise, that good man above know I fought a good fight. And my conscience here today sets me free. But what I would love for people to take away from everything that I've ever advocated, whether or not you came late to class, you choose not to listen to me because you can't get over the fact because of how I dress, how I speak, where I live, how I drive, who I sleep with, how much men I had, whether or not, I don't give a crap. If you cannot accept what I have done because I remain the person that everyone know I am, above board, by the book, I good. He can pull my number any day. But we have a huge opportunity. We have a huge opportunity to fix this because we are still a small country. We are financially stable jurisdiction. We just honestly need to tighten our belt, choose wisely, and that means choosing even from our political people to persons representing each other on these boards and councils, and not let the fox enter the hen house. Good evening, caller. You're live on Sabrina Speaks.
Good evening. How are you there?
Fine, thank you.
I just thought, and I've been listening, and it is a serious thing. You know, I know a country right now that a young man sit outside 3 weeks in a wheelchair. 3 weeks under a tent, didn't get to go into the hospital. By the time you get in, and as a matter of fact, he had diabetes and no legs. You would think that him of all the persons they would try to accommodate. And, you know, I'm listening to this conversation about where we are and what could happen to us. It's really sad that I saw that with my own eyes.
That was here? That was here, caller?
No, that's what I'm saying. No.
Oh, okay. Just for clarity, because
that's what I'm saying.
Okay.
Yes. I said I saw it when you're talking about somewhere else. I won't just disclose
No. Okay.
The police or whatever. And this is just, I went to his funeral last year, I think. He sat outside 3 weeks. I would never know that something weird that I know it could come to that. And I like, come to that. 3 weeks he sat in a wheelchair, had no legs. Both his legs, they had cut off him before.
Mm-hmm.
And he sat outside and old people laying down outside. I couldn't even take it. My heart couldn't take it.
Mm-hmm.
So things that we think are not possible, they're possible. Because if I didn't see that with my own 2 eyes, I would say, no, that couldn't happen. So we really have to be careful. Because I used to go there to doctor when I was young. My father took us there. And it was nothing like that. And that's where it is now. And I see it all the time. They, complaining, the persons that take their loved ones there, that this is happening. And it's not a lie. It's true. He stayed there. By the time he got a bed, I think it was the next day he was dead.
Mm.
I went to give him blood because I have negative O, which is
Oh, negative.
um O negative, which I can give to anyone, and he has the same blood, but he can't take from any other one.
Mm-hmm.
So I've given him blood before, and he called me again if I could give him some blood. When I went, my heart was just overwhelmed, to see the condition, deplorable, and the people just out there, rain, and they getting wet,
Mm-hmm.
the tent. And this is our neighbors, and it can happen.
Mm-hmm.
So we have to be careful. And what you're saying is the truth. We don't see these things sometime until it's too late.
Mm-hmm.
So I pray that others will see what you're saying, and everybody that needs to step up and do whatever has to be done.
Mm-hmm.
I myself right now is facing something that I won't say because I'm going to seek advice before. But it comes back that the government sometimes doesn't do what it has to do for their citizens. And then it's their fault. And they just tell you, I'm sorry, we can't do anything. I know it's our fault, but that's it.
Mm-hmm.
How does that work? What are you telling me as a citizen of my little island? And you know you're wrong, but you don't want to take responsibility. The next department say, no, I can't do anything about it. So you come out and say, well, it's in their court. And they said no. Now, what kind of example are you setting for me? How do I feel?
Mm-hmm.
Now, if someone go to court, let's say a doctor, someone take a doctor to court, a private one. What's the difference if my own government is doing that to me? What about a private sector?
Mm-hmm.
What about a private doctor? And then you go to the same government courthouse to fight the government. How does that look?
Mm-hmm.
And it is something that you tell me already with your mouth. I know we're wrong, but then you don't want to correct it because you said other department not correcting it.
Mm-hmm.
We have a lot of issues in our little island, and I keep praying for our island because I don't want to wish the worst on my island because that's where I come from. That's where my family. That's where I was born. Regardless to what, that is home. Don't care where I go. So I don't want to see the worst for my little island. I want to see the best. I want to see everyone treated fairly. And we needs to have sometimes these things come from not like doing the budget correctly or spending within our means, a lot of things, right? And unnecessary things, like you say. So I pray that, things turn around and everybody starts and you open because you're giving and you're feeding now what people didn't know and didn't understand. So you're feeding others for others to realize the process. So I hope that we all listen instead of judge and saying anything. Just listen, and you can check it out for yourself.
Mm-hmm.
You could go to the proper, I guess, departments. You can call. You can ask. You go online, and then you could satisfy yourself. You don't have. They don't have to take your word, right? You're there giving it to them, but they don't have to believe you. When they can believe is when they go and see it for themselves or call and understand that this is the truth.
Mm-hmm.
It doesn't matter who give you the truth. It could be your enemy, it could be your friend. Once something is clarity, it's good for all of us.
Mm-hmm.
It doesn't matter who gave it to you. The messenger is not so important. It's more important the messenger, what they gave the message, not the messenger.
Mm-hmm.
The message is what they need to say. Let me take this in.
Mm-hmm.
It don't matter. And I think and hope and pray that we're doing that we're taking in the messages. Forget about the messenger. You're there. And if they appreciate you, yes or no, or me or anyone else that comes and give her 2 cents, right? The most important, see what the message is. Don't worry about the messenger.
Mm-hmm.
And then use it for your own tools. And this is the only way we're going to get a better Cayman.
Correct.
All right. Have a
Thank
good
you
evening.
so much. Thank you so much, caller.
You're welcome.
Sure.
Okay.
While that caller was there, I bumped into another piece of legislation, and this is going to blow your socks off because it's called the Health Services Fees Law 2002 revision. And in short title, the law may be cited as the Health Services Fees Law of 2002. And fees payable, subsection 3, fees payable by patients of the healthcare facilities, except otherwise provided by this law. The fees specified in regulations made by the Governor and Council shall be payable by the patients of the healthcare facilities. Okay? But listen to this. Under subsection 9, and I have to be jumping back up and forth because that's how these laws are written, not to confuse you, but because they all intertwine. You remember there was a member of parliament who kept saying, we need to give health free to this person, that person. And yes, because we have to do it. Okay. Under this piece of legislation, subsection 9, that I would tell Anna that it's already free. Because the Ministry of Health and Wellness has 21 outputs that covers for these things. So what was being spewed for theatrics was all BS because it's covered here. Under this law, not me, it's in the law, free treatment. Sit down and listen. Subsection 9, subject to section 2, which subsection 2 says, in this law, Caymanian means a person possessing Caymanian status for the purpose of immigration law, 2001 revision. The Director of Health Services includes a person authorized by him to act on his behalf. And healthcare facilities means the Georgetown Hospital in Grand Cayman and Faith Hospital in Cayman Brac, and any other public health facility or public hospital established or operated by the government. Okay? Remember now, stick with me. Stick with me, please. It says free treatment, subject to that section that I just read. And section 10, which exemption to not apply under certain circumstances, and I'll tell you what that means. Oh, you gotta be running up and down. I soon get giddy. Fees are not payable by a person at a healthcare facility if the patient presents a card issued or recognized by the Director of Health Services identifying the patient to be a public officer or spouse or dependent of a public officer, but only to the extent provided in the terms of the employment of the public officer. B, a member of the Cayman Islands Veterans Association or the spouse of such member, still under free treatment. A member of the Veterans and Seamen Society of Cayman Brac and Little Cayman, or the spouse of such a member who satisfies the conditions specified in subsection 2, which was what I read earlier. It continues. A member of the Cayman Islands Seafarers Association, or the spouse of such member who satisfies the conditions specified in subsection 2, earlier section that I read, stick with me. A person receiving a pension from the government or the spouse of such a person. F, a patient who is being investigated or treated for AIDS, tuberculosis, or malaria, if so certified by the medical officer of health, or a prisoner as defined in the prison's law, Law 14 of 1975. I still under free services. Want to stick with me? Subsection 2. The conditions referred to in C and D of the subsection are the members of the Veterans and Seafarers Society of Cayman Brac and Little Cayman, or the member of the Cayman Islands Seafarers Association shall be aged 55 years or older at the date of requesting treatment. And B, the patient, or if the patient is the spouse of a member, the member shall have produced written evidence of having been a merchant seaman for a continuous period of at least 3 years, beginning from the 31st of December, 1984. And here we say. Now, the exemptions from the waiver of fees provided in all of those sections that I just read do not apply in respect of a person who is covered by healthcare insurance, which would otherwise cover the fees to the extent that such insurance cover is in force. So that means if all under those sections that I just read about seafarers, veterans, yada, 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 if they actually have insurance coverage, then that section is not free. But hold on. Guess what it says about children? Subject to this exemption that I says, fees are not payable in respect of a patient at a healthcare facility if the patient is not attained the upper limit of school age as defined by the education law. That means children free. As it pertains to antenatal services, fees are not payable if antenatal services are provided at a healthcare facility to a Caymanian or his spouse. That means even prenatal, antenatal services free if you don't have insurance. Contraceptive services. Fees are not payable for contraceptive services, including clinics, devices, and drugs provided at a healthcare facility to a Caymanian or his spouse. My friends, this is why I tell Nonna to listen carefully when you hear certain things come out of people's mouth about this is what we have to do. The government has already given this stuff free. What more free than that? It's there in the law. It's in the law. Don't be fooled by the theatrics. It ain't no steeple on the floor of Parliament or on the House of Parliament, which means not all the time they can tell you the truth. And then you got some who's willing to tell you the truth, but on the fall for foolishness. Do you all just realize what I read to you guys? And you got to wonder why it's continuing to cost us that amount? Because all of that is free. Somebody has to pay for it. And if it is not funded, you ain't going to have access. If it is mismanaged, because it's not like government not funding it, but then if there's room for mismanagement, because you don't have activists out here who are educating you as to your right, then those monies get directed to somewhere else that is not giving you value. And this is why I read the definition. Because when I told you, Caymanians, you have rights, they're not doing you any favors when you go to HSA and they question you about you can't get service. Caymanian means a person possessing Caymanian status for the purpose of under the immigration law. You hear me? Don't make them fool on it with their foolishness. It is covered. You ain't begging HSA to serve you. You're covered by law if you're sick. Even for birth control. Even for the IUD in the whatever D. Yeah, you're covered. It's under public health. that is also funded by the minister. So when I kept saying these things, nobody was listening. Nobody was hearing me. I swear it's like I was speaking a different language. I was really blown off of my chair when I heard someone who knows better. But to make themselves look good, they convinced all of you seniors out there that you weren't getting it for free. And you fell for that. But I said it. No, they're 21 outputs. I remember it like yesterday. They're 21 line items. And you think that person making those theatrical appearances on the floor didn't know that I was telling the truth? But you all are so gullible. You fall for foolishness. Good evening, caller. You're live on Sabrina Speaks. What's on your mind?
Good evening. Just some questions in relation to what you read out in the law just a while ago, right? Talking about children being covered up until school
age.
What is that defined as? What is that age defined as? Because isn't preschool required by law now before you enter school?
But even once they're even in tertiary studies, or you can prove. But the bottom line to take away from this, my dear friend, is that once you are ill and you are Caymanian as defined under Cayman immigration law, and you don't have insurance, you're entitled to care.
And I was going to ask you that. So and it specifies that you have to be Caymanian, not just the resident
that's why
on the island.
that's why in the definition it says Caymanians.
Okay. Another question. Doesn't the health insurance law counteract that by requiring all persons residing in the Cayman Islands to have health insurance coverage?
Well, you see, under the same thing where the exemptions do not apply because of that Health Insurance Act. It doesn't apply that it's free if you're covered under. But I see where you're going with that question, because we are seeing where persons are choosing not to cover their kids because the premiums are so high. And maybe this is a caveat to catch those who may actually fall in that bracket. And this is where we need to really look at putting more teeth into holding those insurance companies in the law accountable so that they can also share the weight. Because this cost that I'm saying here is because of exactly what I read out there. And if they're
sustainable to keep going.
There we go. You said it.
Ultimately, it's like
it's going to come home to roost. But then what does that say to the vulnerable?
Yeah.
What does that say?
Yeah.
What does it say? You know, so this is why that law came into place, because it was expected for those persons who are working age that the fees would be competitive enough where persons would be able to buy in based on once they're employed, that their employers then have to do the medical insurance. But then what happens then? We're seeing where they don't have to report anything. We're seeing where they only take you to so long. And when you become chronic, then that bill then falls under us. And if you're a Caymanian, it's enshrined in law that we have to take care of you. Then where does the enforcement arm comes in then, which is, again, the gatekeepers for boards and councils to hold these unscrupulous people accountable. But again, if certain things are silenced in the law, and from what I have been told from the industry, I've been the only minister that has actually wanted and requested to sit down at the table to get the insurance feedback on this to prove that I wasn't coming after them. I said, let's have a talk, because we can't do this.
Let's be real, more and more, since you have no longer been an elected member of our parliament. It was a definite intention to not put you back in. Because you were stirring up way too much. You were going against the grain. You were calling out things that they did not want.
Like I'm doing now. I educate. No.
Exactly. You know, but I know. I just want to to veer a little bit off, because the real situation is this.
Mm-hmm.
Talking about free insurance coverage, talking about health insurance laws in the country, talking about Caymanians who are on the poverty level, and then where our government has the, what's it called now? Department of Financial Assistance, DFA.
Yeah, that, but former NAU. Mm-hmm.
Right. A real problem is you have people that have children
Uh-huh.
that would be required
Right.
by law, because you're supposed to insure your dependents, except for the spouse, unless if they're employed. And they are taking on, they're qualifying, unfortunately, for only minimum wage jobs, right? Or just above. And they simply cannot afford
The premiums.
the premium for a family plan. So when you do the math, it's to their benefit to stay on NAU. And that is the sad reality of it all.
Well, you
Thank
see,
you very much. Have a
thank
wonderful
you. Thank
evening.
you so much. Sobering as well. And I think you would understand then why many a times in this space and even on the floor of Parliament, I kept saying we can no longer work in silos. We have to actually come together if at the end of the day, we are doing something in the best interest of the well-being of our people and in the best interest of our people. We can't no longer because, I'm not into the bedside nursing side of things, I can't speak to the insurance people, or, because I'm in the Ministry of Health, I'm not supposed to speak to the NAU because that section of the law is only for them. When you do that, you have issues like what we're seeing right now with the referral systems going awry. Good evening, caller. You're live on Sabrina Speaks. What's on your mind?
Good evening, Ms. Sabrina. First time calling the program.
Hi, welcome. Congratulations.
Yeah, I was listening to what you were reading up there just now, and I had this problem about probably 2 years ago now.
Mm-hmm.
There, I went to the walk-in clinic, right?
Mm-hmm.
At HSA.
Mm-hmm.
So I told the people, the receptionist, well, I need to see a doctor, right? So she asked me for my insurance. I said, well, I don't necessarily have any insurance. She asks me, well, how you gonna pay to see the doctor?
Mm-hmm.
I said, well, as far as I know, I usually come in and they usually mail me or send me an invoice or something from the HSA. He said, no, sir. You're gonna have to go down to the back to the financial department and fill out some forms and talk to them and get what they gonna say. So she didn't let me see the doctor until I went down in the back around the building to the financial department. And I went there and I had an argument with the little Jamaican girl that was there, that she's like, I don't know what she is. That she come in and she's I don't know if I would call her a gatekeeper or whatever she was.
Mm-hmm.
And I'm arguing with her because I told her I wanted to see the doctor. I don't have any money.
Mm-hmm.
She asked me, well, you not got $25, and you know how we can get our money? You think the government could afford to give people that people see the doctor and don't pay anything? One long lecture and she gave me one long lecture she gave me. She said, well, you not got $25 now to pay to see the doctor. I said, no. I try to keep calm with my situation that I got to see the doctor, and she's harassing me for pay, and I never did get to see the doctor.
Oh my!
Because she's saying that there was a new law in place now that you had to fill out these forms with the financial department down the back at the hospital. So I don't know if anybody else went through this situation before, because far as years and years before I would go to the hospital, they would mail you, and you would deal from it when they send you a mail or whatever. But now it's coming like they want you to pay something down right away and to work out a payment plan and all that kind of stuff at the financial department in the back of the hospital. So, and I was denied seeing
Oof,
the doctor.
that's
So
wrong.
that is a
That's
negative
wrong.
experience. So what is down on paper isn't necessarily what it
How it's being
practiced in there.
practiced.
So
Yes. But now I'm telling you the
yeah.
law. I'm telling you the law. And at the end of the day, um, you may have a shy of a national ID to prove that you came out. You may have to go with your passport next time to tell them under the health service fees law, you are a Caymanian and you ain't got no insurance. And this is one of 18 governing laws that the Health Services Authority is governed by. This is one of the 18 pieces of laws that is they are actually operating under. And if you don't believe me, log on to HSA. It's there.
I would have show my backside next time and just
Oh no, you can't tell them that because you're not that not got no nationality on it, man, my friend. Oh God, you something else.
I'll leave you there, but
All right, my love.
experience.
All right. Well, now you know. Now you know. I'm sharing the website that actually has the 18 subsections of laws so that you can see it for yourself. And the one that I am talking about right now is, I just posted it, is the actual health service fees law, which would be the first row, second on your right. It's the first on the right hand side in the second row, and there's 18 separate pieces of laws, governance piece of legislation that is under there, right there for the public's domain. So call me your GPS. I'm sending you to where it is. You can fact check everything that I've said here. You can even find a Health Insurance Act under there. You see the Health Practice Act, the Mental Health Act, the Pharmacy Act, the Prescription Act. Public Health Act is there too. Freedom of Information Act, the Procurement Act, Public Authorities Act, the Public Management and Finance Act. We were talking about the deceased today. The Coroners Act, Confidential Information Disclosure Act, the Limitation Act, the Workmen's Compensation Act, because they are a statutory authority. Remember, they're not core. I told you the difference between that yesterday in yesterday's episode. Then you got the Public Service Management Act. Remember, that's the one. That is the one now where Auditor General answers to under that law. And the Health Care Decisions Act. Also there in the very top row is the Health Services Authorities Act that I was reading to you today. So at the end of the day, you something else, I see your message. At the end of the day, you can't say that I'm not educating you, Good evening, caller. You're live on Sabrina Speaks. What is on your mind?
Good evening. Your topic is hot again this afternoon. I don't know what your partner soon run over with all these vegetables and everything.
As long as I'm educated, I'm willing to educate on it.
I told him I could be the devil's advocate because I heard through the grapevine, and sometimes I like to get it. I can't sit and spit in the horse's mouth, but being an ex-minister of health, do you know anything about that Cayman Hospital, the Health Service Authority? Is Jamaica, the University of the West Indies, has shares in the Cayman Islands Hospital?
I'm not aware of that.
Well,
No.
somebody asked me, and I told them, well, I don't know, but they said they were told from some high authority, the Jamaican, told them that they want us to know that Jamaica has shares in Cayman Hospital. I said, well, I wouldn't say yes, and I can't say no.
I will I will definitely check into that one.
But I told him, I said, but I tell you,
I doubt that.
if you look at the population up there, something,
I can understand why. Yeah.
Because that part is going one direction.
But
All
bearing
the
in
bad
mind,
is-
a lot of those persons from Jamaica by now have been there from my days and before I went there in 1990. They are long term. We've seen where they continue to grow, but I can understand where you're coming from. And a lot of them there are actually Caymanians.
Yeah, but a lot of them
So
are not. You got some new ones.
yeah. No, but I get exactly where you're going with that. Mhm.
It really looks like you going in the wrong direction.
There you go. Mhm.
I would be the devil's advocate.
Good little chuckle there. Good little chuckle there. Thank you, my love. All right. Have a good evening. The caller, you can call back. I'm about to wrap up, and we had an earlier caller who was talking about the NICE in the United Kingdom. Here is the link for that. Let me copy this link, and I'll share that so you can again, for a good read, instead of talking about people, go read that. Let's educate each other here. And for the other caller to say he could show him his backside, everybody here is saying, I met my match and I should give that caller a kaboom. So yes. That was funny. That was funny as heck. Oh my God. That one really caught me though. Yeah, he is my match. He is my match. I gotta love my people. Hello, caller. You're live. Welcome back. What's on your mind this time? I shared the link.
I had to call back because I was like, okay, you're doing a little bit of overtime. I'm not taking it long, right?
Oh God, by a minute.
You see that thing that you talked about Caymanians being
the definition?
Caymanians who don't have insurance and that kind of thing are entitled to care.
Mm-hmm.
What kind of care are they gonna get? Because you already got people who can afford it running from the HSA now to go to private. What kind of care are those entitled Caymanians going to get if they don't have a proper standard, if they don't have no standard of care? I'm going to bring that back to my point. I'm going to listen.
Yeah. You're onto something there, though. You're onto something there. But this law was specific, which is why under the definition for health service fees law, it defines healthcare facilities. And the definition in this case means the Georgetown Hospital in Grand Cayman, Faith Hospital, Cayman Brac, and other public health facilities or public hospital established or operated in the islands by the government. This is why now you need a referral to go private. Because for free service that is given to all of those persons that I read out under Section 9A, a public officer, their spouse or dependent of public officer, not only by the extent provided under the terms of employment of the public officer, a member of the Cayman Islands Veterans. You know that section that I read out? This is why they have to be referred by a doctor at this healthcare facility to go private. And when they do that, then the government pays because the services privately are no longer free. You get it? So that money is transferred where it would be free at this facility because they are being referred privately for whatever reasons. We're not delving into that. It then has a cost because those private facilities comes with a fee. And because government is responsible, they then pay that bill.
Yeah, but free, listen, look at
it's not in its true term because somebody has to pay.
Sabrina, I'm gonna say this to you, right? If you want something done, consider two of these three things. You want it good, you want it fast, you want it cheap.
Yeah.
You can't get all three, right? And if the law is saying that these persons that you have
cited there,
the law cited there, right? If it's free and it's not good, right? Because you have to have
I see where you're going.
there. You have to have a standard of care in there, because what's the sense of me? Yeah, I get free,
Drive it home, my friend.
but I'm not getting the quality care that I'm in, that to me,
Yeah.
right?
Yeah.
So now it's like, all right, well, now I guess I got to. Oh, I don't know.
No. You're putting the bow on everything, which is why it's important that we have a national standard. And this is why then you would hear now, it's putting all of the previous conversations that I had. When you hear me saying value for money is what that is saying. So you see, you may not understand the terms when I use it in an earlier episode, but when I read this, now the terms is making sense. And you're like, that's what it means. That's what we mean when we say the people are not getting value for money. When you have people that are not being held accountable for the mismanagement of your money.
Yep.
So it is coming around. You put the bow on it. So you see, even when you brought that question up earlier on, it wasn't time. But now it makes sense, because with me educating you of the law, and now you bring it back up, and I'm sharing the links. You see where it all makes sense, why it's important for us to have a national document? Yes. So people are more now, if they're paying attention, more accepting of the suggestion that it's imperative that we have a national standard.
Yep. So with that being said, I bid thee good night, fair lady.
Good night, my friend. It is always a pleasure. Thank you so much. And, again, this makes these episodes so much more informative when you can have that caller who challenged the system, who asked a question, and then it all came around in full circle when the law made sense, coupled with the law of the caller who wants to use his national ID as his laurels. His national ID could be his. Oh, God. Yeah.
Wait, say, look, we should come in up.
No, but I'm going now. But you see, Alfred. But you see exactly where it's driving us to, and it should never be. But then that's very interesting what kind of ID that caller is going to use, because it ties in to, if you're not walking with your passport, which we know does not make you a citizen, is it time for the conversation for a national ID? Caller, leave me there, because that may put us into another hour in Anna doing that tonight.
Will do. Looking forward to
Take
tomorrow.
care, my love. Yes, man. Good night. Take care. Denver, imagine HSA Chief Medical Officer denied my application for Health City referral because there was no medical records at HSA. Please say. Imagine HSA Chief Medical Officer denied my application for Health City referral because there was no medical records at HSA. Oh, really? I need to know more about that. No, it's Denver. Thank you for sharing that. But that's interesting. I could look at, without going into personal your business, if the services were not adequately available at HSA, or if the wait times were so long based on what you presented with Denver, then it shouldn't matter whether or not you had medical records at HSA, if you get what I'm saying. But if what you presented with, the services were adequately available there, and the wait times could be proven not to be long that could actually pose a problem to you, then that may be the case. I don't know. Without more context, I don't want to weigh in on it. But thank you for making that public. That a Cayman behind stamp is right there. Yeah, Connie. But no, it has been, I hope you found this evening's episode, again, very thought-provoking. Yeah, my cynical health has been approved. Oh, yeah. Okay. So you're cynical, and because of the referral process, Denver, that's why. Now, whether or not, if this is your first time ever requiring health services, and you just, let's say, wanted to go to Health City because it was your choice, then the reason alone, because you don't have a medical record at HSA, does not alone bear water. So again, yeah, it's a bit hard to have it here in this forum, the conversation as to why, but you have a right to appeal the decision, Denver. You have a right to appeal that decision of the CMO. There's a right of appeal. But I hope that you found this evening's episode, again, very thought-provoking, informative, and educational. And again, with your participation, it makes it a huge success. But I'll leave you with this thought. Healthcare is not just a service, it is a promise. And a promise that when we are at our most vulnerable, there's the systems that will protect us. And that our leaders will have to act with integrity. And that our laws will uphold our dignity. And that no one, Caymanian or not, should be left behind. You see, when it comes to that law, Caymanian, you're entitled to get care. Yeah. Now, we've looked at the Health Services Authority Act. We looked at a number of other legislation, and we dabbled just a little bit even into the Constitution. I could go a little bit more into that, but that would need to be another subject. But we looked into the role of the ministry and even the board of directors and what their remit is of our statutory authority. So we need to ask and look at those questions that turn to us. So are you informed? Are you empowered? Are you ready to demand better? Because systems don't change on their own, They change when people speak. I'm educating you. There's only so much more I can do. When communities rise and we stand together as one, that's where you see change. And when questions are asked and answers are demanded, you're entitled. They're not doing you a favor. I've never used HSA except for being born there. And when I got into an accident, so I haven't had, so I would not have a medical record. Yeah, Denver, you can appeal that. You can appeal that request, Denver, honestly. So yes, until next time, it has been a pleasure. I'll leave you with this. I know we've been having some hard-hitting topics, and I'm not even apologizing because sometimes the hard knocks of life has to hit you hard. The reality, it's real. And the more I educate you, the more we can have informed discussions. And when you actually speak and advocate for yourself, that it comes from a place of knowing, and you know that you have the laws there to back you. Until next time, it has been my pleasure. I'm Sabrina. And this has been another Sabrina Speaks. Have a good evening.
That's a wrap for today's edition of Sabrina Speaks. Thank you for tuning in and for being part of the conversation. Remember, the dialogue doesn't stop here. Stay engaged, stay informed, and most importantly, stay empowered. We'll be back tomorrow at 5 p.m., same time, same place, right here on CMR TV and radio, where your voice matters and your truth is heard. Until then, Cayman, take care of yourself and each other.
That's it for today's edition of Sabrina Speaks, where your voice matters, your story counts, and your truth is always welcome. Join us weekdays from 5 until 6:30 p.m. right here on CMR TV as we dive into the topics that matter most to you. Catch the show live or on demand at cmrtv.com. And don't forget to follow us on Facebook, YouTube, and Instagram so you never miss a moment. Until next time, stay informed, stay engaged, and always speak your truth.